My name is Chen Yongqi. I'm a physical therapist and acupuncturist. Today I'm gonna talk about a little bit about shoulder condition, mainly about frozen shoulder versus rotator cuff tear. We as a physical therapist and acupuncturist that we have to define whether patient condition or whether patient's main complaint is really coming from the rotator cuff tear or due to the rotator cuff tear that patient suffering the frozen shoulder. That's the main reason why patient suffering. So usually people who has a shoulder pain, they go to see orthopedic doctor and request for the MRI because they think of that they are having rotator cuff tear. Automatically when they request, then they are gonna take the MRI, and then obviously very natural that all over 20 years old they all have some kind of tear on the shoulder joint. So without thinking, and they just ends up sometimes with a small surgery or arthroscopy surgery on the shoulder. But then here's my recommendation is, as I see patient in here, a lot of shoulder patients that come with the rotator cuff tear MRI, usually they are not really suffering from the rotator cuff tear itself. It just ends up with the frozen shoulder because of the rotator cuff tear or some other underlying disease, such as they're having suffering diabetes or some other minor injuries before. So when they come here, they complain a lot of stiffness and then difficult to move of the shoulder. So by the time they come, I usually recommend them try to modify their daily activity and then do home exercise program, and with the little aggressive manipulation of the shoulder joint that we can remove the stiffness or break the scar tissue inside so that they can get back the like a functional or normal range of motion on the shoulder. Obviously it's very painful moment that they will doing manipulation in here, but then with the acupuncture and some exercise pre-exercise program before the manipulation, that may cause reduce a lot of pain. And even after physical therapy, like 1 or 2 months later, if they still complain of pain without any stiffness, then that's the time that we confirm, okay, this is the coming from the rotator cuff tear. It's not only from the, it's obviously there is no stiffness anymore, so frozen shoulder is gone now. So this is the time that we confirm this pain is coming from the tear by itself. Then I'm gonna usually we refer back to the orthopedic doctor to consider about either injection or surgery. So this is the way how it's supposed to be. I really want everybody who has a shoulder pain try to get the professional advice before they decide to have a surgery. Usually people have a shoulder pain, they decide themselves because there are a lot of information in the internet that they confirm their diagnosis themselves, and then they decide to have an MRI, and then they decide to have a surgery by themselves. So even also be the doctor that asking, okay, try to do therapy or acupuncture or home exercise first. And people usually like they already made up their mind that okay, surgery is pretty simple, that I'm gonna do the surgery itself first instead of being bothered by the exercise program. So here's what I'm recommending. Please, the after you get, I mean, hopefully not, but when you have some shoulder condition or other condition, please get the professional advice before you decide yourself. All right. And next time we're gonna talk about the knee condition. Thank you. Bye bye.